Good morning, everybody, and welcome to Let's Talk Stroke. I am your host and stroke survivor, Jerry Walls. And for those of you that are new here, why I'm doing this is to bring awareness to stroke, TBI, aphasia, brain injury, and also to provide a platform for all survivors to share their journeys, their stories from across the world. And also bringing on experts in brain health, experts in, with health professionals out here to share their knowledge for all of us to learn. And but also this morning's guest is Dr. Ortiz, who is one of the directors at Lonestar 24-hour emergency room here in my hometown here in New Braunfels, Texas. It just lets you know I was recently seen there, and this is not your typical emergency room. So we'll get into that, and so you guys can learn how different this is. But also, please ask questions, make comments, get involved. And also, if you have not subscribed to my YouTube channel, Let's Talk Stroke, let's go ahead and please do that. That would be great. So let's go ahead and get started. Well, good morning, you guys. Jenny, Mark, Aubrey, nice to see you. Jocelyn, it's great to see you guys. And make sure you share this content. You don't know who could be using this and learn from this. So good morning, Salud, Michelle. So let's go ahead and, all you guys, thanks for being here. Let's go ahead and bring on Dr. Ortiz. Good morning.
Good morning.
How are you?
I'm good. How are you?
I'm doing terrific. You can see all the comments on the left and the right.
Yeah.
Yeah. So you guys ask questions and make comments. And good morning, Violet, Heather, Teresa. Well, a lot of guys showing up here. I love it. So. So, Doctor, I know you just worked your shift and at Lonestar, and as you know, I was recently seen there, and wow, what an experience I had. I mean, I've been in emergency rooms for a long time, and for me to go to an emergency room like yours, holy smokes, it's like state of the art. It was just amazing, and I appreciate that. Because who's not nervous and going to an emergency room?
Right.
But, I mean, the care that you provide is just, it's hard to say. It's really amazing.
Thank you. Yeah, that was sort of the intent behind it. We've been open now for about 4.5 years in New Braunfels. It's our only facility. We group of doctors and I decided to get together, and we're all ER trained, board certified in emergency medicine. We practice all over the country. We practiced in academic centers, trauma centers, little rural ERs in the middle of nowhere, and we decided to kind of take our talents to New Braunfels and sort of open up a patient-centered emergency room. Nobody wants to be in the emergency room, and we get it, but it doesn't have to be the people factory. Move the patient experience that you experience in some of the bigger hospitals. So we decided to open up an ER that provides the same level of service, if not better, medically speaking, but then also one that caters to the patient and tries to make it as pleasant of an experience as possible. So it's been great. I've truly, this has been the best 4.5 years of my career.
Yeah, I bet, because from what I've seen, what I experienced, and I'm not just throwing it out there, but it's nerve-wracking. Like you said, to go into an ER, who really wants to be there? But hello, you guys. Lynn, I just love to say hello to you. I don't want to leave you guys out. Salute, yeah. So, salute. I'm so happy that Dr. Ortiz is here. Exactly, me too. But yeah, so you, it's great that you came back. I don't know if anybody knows your story, but you're back. You're a UT guy.
Oh no, I'm an A&M guy.
A&M, sorry, yeah.
A&M, ooh, no. Technically, my medical degree is from a UT school, but we don't, yeah. I went to A&M for college, and I went to medical school here in San Antonio. Yeah. Went away to Colorado for a few years. I trained at Denver Health Medical Center, which sort of the birthplace of emergency medicine. Trained under some of the best ER physicians there are, and practiced in Colorado for a few years, and my wife and I always wanted to make it back to Texas, so this opportunity came up actually with one of my med school roommates. We got together and came up with this idea, and glad to be back in Texas.
Yeah, exactly. Now, yeah, I know that you were was, uh, you took part or developed some protocols with sepsis because I know a lot of people who have had strokes. A lot of them that I interviewed have sepsis.
Yeah, so sepsis, you know, stroke, heart attack, and sepsis are sort of the three uh, big diseases that emergency rooms, that hospitals really focus on. And so I've worked closely with uh, different organizations and within our system itself to develop sepsis protocols based on best practices. So, you know, it's antibiotics in a timely fashion and fluid resuscitation and making sure that you know you treat the sepsis aggressively before it becomes a bigger problem.
Right, right. And I can see Mike Peters here. He's from the South Wales, United Kingdom. He has a question for you there. Do you see that?
What's that? Yeah.
The question. Let's see. Let me bring it up here because these questions are going pretty fast here. Here's one.
You know, so I see mental health. We actually do have a licensed counselor on our staff that is available should anybody need somebody to speak to. She's been a wonderful blessing to the staff. Sometimes we need help too,
Yeah.
and that's okay. It's okay to ask, and we definitely have someone that we can put you in contact with. And she's been a great resource for us and for our patients.
Wow, that's terrific. Yeah, 'cause I know that a lot of people don't want to ask for help, but it's okay to ask for help.
Well, it is, and it's like you and I discussed that stroke is, especially stroke. It's one of those. It takes a village kind of people to help navigate through it, right? I mean, it's not just a medical. There's a mental health. There's a big mental health component to it, and adjusting to a new way of life and a new way of thinking. And yeah, we do offer those resources, and I encourage people, whether it's through us or someone else, if you need them, seek them.
Right. Um, so I just missed it, but what are the protocols for sepsis, or what's the alerts should people need to know?
Yeah, so you know, sepsis all starts with what's called SIRS criteria. It's the systemic inflammatory response syndrome, and that's based on your vital signs and a couple laboratory tests. And if you sort of rule in based on this criteria, whether you know fever, fast heart rate, fast respiratory rate, your white blood cell count, um, and then if you find a source of infection, right? So somebody has this response, this syndrome, and then they have a bladder or a kidney infection or pneumonia or a cellulitis or something, you automatically rule in as sepsis. Now you have to determine whether it's severe sepsis, septic shock, and so it kind of breaks down from there. And based on lactates and different blood tests, you can kind of determine how aggressive you need to be with the fluids, um, how quickly, how timely you need to be with antibiotics, and just go from there. So it's, you know, I think protocols, you know, there's a reason airline pilots have their checklist, right? It doesn't matter if you've flown once or 10,000 times.
Absolutely.
I think you and I were talking about, you know, you've got your checklist. So there's no reason that medicine can't follow suit in certain things. Now, there's definitely an art to it and an experience, but you know, in a critical situation, it's good to have evidence-based approaches already lined up and ready to go.
Right, right. I definitely want to. Let's see here. I just want to bring this up because if someone wants to see what your place looks like, because it's absolutely wonderful. I just got to brag about you guys. This is amazing, right there.
Yeah, we're right there on Highway 46 and 337 in the West Point Village Shopping Center. So it's a great facility. We got good snacks for those
Yeah.
who, you know, hopefully you don't wait too long, but if you have to wait a little bit, or if you're waiting for a loved one, we've got, you know, things, you know, we have a pediatric room for kids, and Netflix and Nintendo, something, I don't know, one of those video game systems.
Yeah.
You know, what I've found, I've been able to take care of lacerations on kids without sedating them, just by letting them play video games while I'm doing something to the back of their head, you know, sewing a little cut. And, you know, it's amazing what distraction can do. And then you cut out the risk of sedation and the extra time of being there with sedation. And Kids don't even know you're taking care of a laceration on their head, and then they go home.
Right.
So it's really neat. It's nice not to have big corporate policies dictating what we do. We can just practice the best medicine we know. And I think we've done a good job of that.
Absolutely. What I keep going back to, I experienced your place, and even getting blood taken, the EKG and all that.
Mm-hmm.
I mean, I felt like I was at home.
Yeah,
you know, so
that's great.
homey.
Yeah, that's the goal. We hire people that we think fit within our kind of our idea of what it should be. I mean, number one, you have to be good at what you do.
Right.
But number two, you have to be willing to go the extra mile and make it as comfortable for the patient as possible. And I think we've done a really good job of, our staff is phenomenal. And my daughter still asks for a certain nurse every time. If she needs a shot, if she needs her flu shot, she wants to go to my place because she wants a specific nurse to give it to her because it doesn't hurt.
It's so funny because I totally agree. Kelly, sounds marvelous, Dr. Ortiz. You need one in Fort Worth.
We'll look into that.
Yeah. I have a little a cut that I ran into like this plant thing in our house, and it was bleeding really bad. So put a Band-Aid on it and all that. But it was so funny. I said, I need to go back to Lonestar, because she goes, you're just gonna bug them, because I wanted to go back. It was just a little cut, but it wasn't a staph infection. It didn't look like it was going there. I said, Barb, I'm going to go back. And for that, it was just so funny that I really want to go back. I mean, but
yeah, we have kids that have wanted to come back too because of good experiences they've had. So it's a neat, and one of the things that we do is we'll tailor our care to the patient. So if you come in, we don't have a problem saying, it may be inconvenient, but come back tomorrow and let us look at it again. We're not collecting another copay or anything. We just want to look at it again and make sure it's healing right. And we have the ability to do it. We're really good about sign out. So even if the doc who didn't see it before, we'll make sure that the doc coming on knows, and the nursing staff coming on knows what it looked like the day before, so we can make the right decision. We don't want to just give antibiotics for the sake of antibiotics, or just do a CAT scan for the sake of doing a CAT scan. If there's a more conservative route that's safer for the patient and the patient's agreeable to it, we'll go that route.
Wow, that's great. And then, there's another Yvonne. She's from Athens, Greece. Do you see her question there? How do you deal with the emotional?
Yeah, that's a great question. So I think the most important thing is to not talk to a patient, but talk with a patient. And it's the same thing with the family. It's not lecturing. It's just sitting down, holding their hand if you need to, whatever it is. And I think that's the first step, is just trying to connect with the patient, communicate with the patient. A lot of times that works. Again, sometimes these ERs are so busy that the provider doesn't have the time to sit there, and it's a lot quicker to pull out a certain medication and just make the patient sleepy. But we don't have to do that. We're busy, but we're not overrun to the point where we can't take the extra time. And I think a lot of times once you connect and you can just speak in a calm voice, and I think that's step one, and that's a step that's often overlooked.
Yeah, absolutely. And one of these, there's questions coming out here. Kelly's asking, how do you treat patients coming in with a brain injury?
Yeah, so the first thing we do is we try to determine the extent of the brain injury. So neurological exams, CAT scans if you need to, and then it's just a matter of is this a patient that I can treat overnight in my facility, or sometimes we have to send patients to the hospital and to see a neurologist or a neurosurgeon if they need an ICU. So we frequently do have to we try to keep people in New Braunfels as much as possible.
Right.
Like I said, we want to keep people in the community. We're trying not to send them all over to San Antonio. Sometimes if they have to, they have to, but we've got a good partnership with the hospitals in town, right, with Resolute and with Christus.
Yeah.
and they take most of our patients as long as they have the capabilities to do it, and it's a multifactorial approach. But the first step is figuring out the extent of the injury and what we need to fix it, and then we go from there.
Yeah, and you've recently not treated, but you saw some stroke or TIAs or something. Just recently.
Yeah, after we met, we had a patient come in with a stroke, diagnosed it, and had her in the stroke facility within 45 minutes, I think, of her walking in our door, which is great. As you know, time is important.
Sure.
She presented, I think, relatively quickly, and we got her taken care of pretty quickly. We've had stroke mimics, so that's the other, to complicate an already complicated situation, right? There's stroke mimics, and so we've recently had a patient with a stroke mimic as well too, that presented like a stroke, but turned out not to be. Thank God for her.
Sure.
And thank God we were able to figure it out quickly.
Yeah, it's amazing you can recognize that. But I guess you're the doctor, so
yeah.
That's great. I Mike, oops, I missed that one. Yeah, Mike saying his best memory was a doctor just holding his hand as he was very upset. That's good.
I remember the other day I had a patient who was a kid, was there with his mom and there with his little brother, and his little brother just really wanted to be held. So I was, and I've got 3 kids at home, and so I kind of held the little brother and played with the little brother while I examined the patient and spoke to the mom. And it was, you got to connect with the entire family, and I think everybody left happy and comfortable. And again, it's not, I don't think, I think when people say I want to be a doctor, I think this is what they think of. Unfortunately, we're not always given that opportunity, but we found a solution to that, and we're able to do it at our place.
Right. Yeah. It's I mean, there was a bunch of comments there saying, let's see, Marina said she wishes there was one in her hometown, your facility.
Well, yeah, we'll get on that on the next meeting. I'll bring it up to my partners.
Exactly. Love about this chit chat was doing all that. It's great to, I always say, make comments, ask questions, and there's a ton of them. I'm sure I missed a bunch of them, but to Lynette Price here. I know Lynette, she's had 8 strokes, bunch of craniotomies. I see her comment there. My emotions were all over the place when they told me they couldn't fix my brainstem aneurysm, and it was leaking. Wow.
Yeah.
So many. So Kelly saying, wow, she can't wait to visit here. If you guys visit here, because I know there's a lot of people here from Texas too, I would suggest go in there. I mean, just to see the facility, and even when you check in, just to check in. When I was checked in, and one of the doctors came right out when they said, I said, I feel like I'm having heart palpitations, and right away, I was brought back, and I think there's a thing that says 10-minute wait or no more than 10 minute wait.
Right.
Maybe that's what.
Yeah, it should. Hopefully it's not even 10 minutes. COVID was a challenge with the volumes that we saw during COVID, but we're hopefully on the other end of that now, and we're back closer to we're busy, but it's not the COVID rush that we had. So we were joking when we made such a nice waiting room, because the plan was to never really use the waiting room.
Right.
And it's mostly a place for family members to wait. But yeah, we try to get people back as fast as possible, especially if you're there with certain complaints, heart complaints, brain complaints. We need to get you quickly.
Yeah, absolutely. And Michelle, is there any advice I can give them on how to communicate more effectively with the doctor and rehab staff?
I think the only thing I can say is you just be honest. Don't say what you think the doctor wants to hear. Make him or her hear what you want to say. the other thing I also say, and it's a lot easier said than done, but if you feel that your doctor doesn't listen to you, then you should look for another doctor. You can ask for another doctor. And hospitals usually have patient advocates too that you can speak to if you're having any sort of issue. There should be a patient advocate on staff. And so I would say be honest and tell them what your needs are. This is what I need.
Right.
This is what I need. And if they can't meet those needs, then I would say speak with the patient advocate, or find out if there are other options as far as other providers.
So hopefully that answered your question there. I see Mike Peters. He's joking around with me. We're all, but he says, "Do you see that one there? That comment?
Consistent cough."
Yeah.
Yeah.
I so funny. Yeah. There was another question here. Salud, a friend of mine who travels the world. She'll be here in June.
All right, we'll be there.
Yeah, and we will go there. Salud, that would be great. And I know, what is this? Another one here. What about for an accent says after stroke?
Yeah, unfortunately, that's a little bit out of my scope. I'm more in the acute treatment phase. I don't know what that would be more for a neurologist or a stroke specialist. We're experts in kind of the acute management of it.
Yeah, absolutely. So what other? I mean, how many staff members do you have there?
Oh my goodness, we have. I mean, it's on the order of 50, I would say. We have 8.
Wow.
8 doctors, and then we have like 13 doctors, including part-time doctors. We've grown a lot. I'd say I think we're on the order of 50 or so. We have nurses, radiology techs, ER techs, patient advocates, front desk staff, billers and coders, management. We've got the best team in New Braunfels. We really do. I'm proud. It's a fun place to work. I'm biased, obviously, but it's a fun place to work. It's a great staff, selfless people. I really enjoy working. I love our team.
Yeah, me too. I mean, just me experiencing that kind of service. For me, unheard of. I've never seen it like that. But it's not your typical ER.
No, we try. We do what it takes.
Yeah, absolutely. Even your tech that who did my X-rays and stuff. So funny. He's such a nice guy.
No, it was. We have fun. You read the room. If the patient is a patient that likes to be a little more laid back and joke around, then we've got comedians. If the patient likes more serious and formal, we can be serious and formal. It's part of the art of medicine, I think, is knowing how to interact with a patient. And I think that comes with experience. And so if we have people who are very experienced and can, we have fun. If patients want to have fun, then we're happy to make it as enjoyable. And you don't want to be there. We get it. And so we'll make it as enjoyable as possible.
Yeah, absolutely. And this is so true here. Kelly, I love y'all's bedside.
Thank you, Kelly. Yeah, that's a big one for us.
Absolutely. I mean, I know Mike is probably thinking it's all about me, but it's not. But I just speaking on the experience that I had there.
Yeah.
And doing you made it so comfortable for me to lay there, and I wasn't left unattended. So it was just, with me having heart palpitations, and then you referred me to a cardiologist after. So
great. Yeah, we've got good working relationships with all the specialists in town, all the hospitals in town. A lot of them, I have their cell phone numbers, and they're willing to take a call any time of the day. They like what we do, and they want to support it as well too. And we've got great support from the community.
Yeah, that's so important. I absolutely love it, but I hope everybody who's out here can tell this is just a great place to to go. And
Thank
if you're here in Texas, which I see a lot of you that are here in Texas, just go. I mean, go in there and see what I see and what I'm experiencing. Because it's not your. I keep saying it's not your typical ER.
It's not. I can vouch for that.
Yeah, absolutely, absolutely. So what others that did we not cover that we want to talk about with your facility?
Yeah, really, it's just a commitment to the community. We were made in New Braunfels. We are in New Braunfels. We're nowhere else. We want to keep people in New Braunfels. Our relationship with the hospitals are with the intent of keeping people close to home, New Braunfels Canyon Lake community, and it's been the best 5 years of my medical career. I'll tell you, it's just been to be able to just practice medicine, and we call our patients back the day after to make sure they're doing well, and address any concerns that they may have. It's been a pleasant experience, and really all I can say is that we're there 24/7, 365. Call us if you have a question. It doesn't matter. They'll wake the doctor up and we'll talk to you. Come in if you need us. We're here to serve.
Yeah, absolutely. How was it during COVID? Because
this was one of the strangest experiences. I've never been in a situation where literally our volume went up 1,000% in 12 hours.
Wow.
I mean, between one day and the next, 1,000% increase in patients, and seeing the staff. We weren't ready that first day, I'll tell you. But we got through it, and everyone got treated. Everyone got treated well. And then luckily, again, we have a system where we can pivot and adjust quickly. We don't have to wait for permission from above. So we were able to staff up and come up with contingency plans and emergency management plans. And I mean, 4 or 5 surges that we've had, and with the patient volumes, while still having all just the typical ER volumes as well too. So it was a challenge, and I've never been in a situation where the recommendations at the start of a shift were different than the recommendations 10 hours later. I mean, everything was changing so in real time that we had people keeping up to date with the CDC. I was with the task force, or with the Comal County COVID task force, if you want to call it. We had frequent calls to discuss, what's going on in the community and what we're seeing. It was a challenge, but it was amazing to see the team get to work and get through it. And we did.
Yeah. You opened, then was it a year or 2 later? That's when it just.
Yeah. About 2 years later. I remember one of my partners, it was, what was weird is COVID kind of hit us around February, March, but we were seeing a lot of people in December with flu-like symptoms that were testing negative for the flu. And my partners and I were just kind of like, what is, this is weird. You would think they have the flu, but it's all coming back negative. Now, looking back,
now
COVID. And I remember I had one partner that it was December or January, and he said, hey, what are you doing, as far as checking patients for COVID? And I said, well, if they're coming from that area of China, I think we need to worry about it. But other than that, I don't think. And literally within 72 hours, it all changed.
Wow.
And it was no longer people who were in that, in this area of China. It was now worldwide and pandemic. And so it changed before our eyes. It was really, I've done the swine flu and the SARS and all the other when we had the Ebola scare, and this one was changing faster than anything I've seen. So it was a challenge, but we got through it.
Yeah, absolutely. Just crazy.
And we're still doing COVID testing for anybody that needs it. Some travel, there's still some travel restrictions with COVID, so we're still offering all the same services.
Wow. But do you have, I can't remember, do you have to wear a mask in your facility?
We do, and I think
Yeah.
that's something that's here to stay. You know, to be honest, it's not only COVID flying around. We have the flu. You know, there's lots of other respiratory-borne illnesses in the medical facility.
Right.
And I think the right thing. I'll leave my personal mask
Yeah.
thoughts aside, but I do think in medical facilities, with you know, if you have a patient who has cancer in one room and a kid who has a cold, well, the cold for the patient who has cancer could be bad.
Yeah.
So we should be wearing masks.
Right.
And so yes, we do wear masks still in our facility, and I think that's something I don't see that changing really in any medical facility in the near future.
Wow. Yeah.
And it's to keep everyone safe. It really
True.
You've got sick patients with lots of different sicknesses, so I'm trying to keep the sickness to you, you know,
Yeah.
and not spread it to others.
Yeah. I know a lot of people, we've talked about, I've said it many times, are really kind of intimidated to go to the emergency room.
Mm-hmm.
What would you tell somebody that, you know, they're hesitant about going to the emergency room? I know that you said to, you know, be honest with the doctor.
You know, I'll tell you, one of the biggest problems we had with the pandemic was people not going to the emergency room when they should.
Right.
We had an increase in heart attacks and complications and strokes that were not taken care of in a timely fashion because people were afraid to go to the emergency room. So my recommendation is if you think you've got an emergency, don't hesitate. And it's our job, whether, you know, if Lonestar isn't in your community, well, it's your local ER's job to take care of you.
Right.
And they should. And don't worry about putting the healthcare workers or upsetting or inconveniencing. That's our job. That's what we're there for. Even if it's 3 a.m, it's 3 a.m. That's we're there to take care of you, and they shouldn't. No one should pass the shame or burden onto you for coming in. If you think you need to come in, come in. Don't hesitate, because that's when real complications arise.
Right. And always ask if because in the stroke world, brain injury world, people are so I don't want to say, but they do get very depressed. So could you tell somebody that's going through that difficult time? It may not be stroke, it may not be brain injury, something, going to the ER.
Yeah, you know, mental health has become a bigger emphasis lately, and I think it's a good. It's a good thing that we're discussing it more, and it's a good thing that we're realizing that we need more resources for patients. That's why we have our counselor, and I think step one is finding the help, and the emergency room can provide resources to find you help.
Right.
And so I would say, don't hesitate to ask. You can call and ask, or you can show up and ask, and we have people that are there to help. And if we ourselves, the physicians and the nurses, can't take care of it, we have specialists that can.
Wow.
And that would be my recommendation, is to not wait.
Right. Exactly. Good answer on that one. So, Lynette, I see that. My doctor.
Yeah,
I can see you guys doing this.
Oh, we've done that. We've done that a few times. It's
really?
Patients that were nervous to come in. I've walked out to the cars, and
Wow.
I remember one. She was in the passenger seat, so I sat in the driver's seat, and the family was with us, and I just sat there and talked to her and asked her what was wrong, and basically got the whole history in the car, and then told her what I think the plan would be if she came inside, and she was happy with what she heard and came inside. We took care of her. We found the problem and we fixed it.
Wow.
So yeah, absolutely.
Yeah, I see that, Heather. Doctors and nurses are so overworked. Absolutely.
Our nurses definitely are. I'll tell you that.
The nurses.
The doctors too, but our nurses, they work hard.
Yeah. I didn't feel like that when I went in there.
Yeah, no, so, they love what they do and they're good at it, and I appreciate them.
Yeah, I 100% agree. Gosh, I really appreciate you coming on, and
this was a pleasure. I really enjoyed this. I'm happy to come on anytime.
Yeah, share your knowledge, and because emergency room, this is terrific. I don't know if there's anything else last you want to say that.
No, I just, again, don't hesitate. If you have a concern, seek help. If you're in our area, we're more than happy to help. It's been a pleasure taking care of the community, and hey, we're happy to be here. We're honored to be here, and I really enjoyed this time here.
No, me too. I'm so happy that we made this happen.
Yeah,
You're on
absolutely.
Here. It's been real fun, and I appreciate everybody out here asking questions. And let's see this one here. Okay, Marina wants you to open one in Virginia.
Virginia, all right. Road trip.
Yeah, all over. All right, Michelle, thanks for being here too. Great show, guys. Well, thank you. I appreciate that. So thank you once again. And
yeah, thank you. Appreciate it.
Yeah, absolutely.
And thank y'all. If there's anything we can do for anyone listening here today, don't hesitate to call. 830-627-0911 is our phone number, and we'll do what we can to help.
Okay, is that?
Yeah, there's our website.
There's a website. I'll keep it up there for just a second, because it's really, don't hesitate. I appreciate you saying that. No hesitation to call you, or
Right. Absolutely.
Perfect. Love you too, Marina. I appreciate it. Love all of you. So thank you. And Doctor, I'm sure we'll be seeing you, I'm sure not too long.
We'll see you in June with Salud.
Yeah, absolutely. That's just right around the corner. So, all righty. We'll have a great rest of your day.
You too.